Well, most hospitals will look at what their experience is in the activity of various antibiotics against specific pathogens, and they'll usually report that in a periodic way, whether that's every 6 months or every year or even more often, which would be optimal, and report that to physicians. And so physicians should have that available. Now, in our situation, we have it available on our computer system. So if we're seeing a patient, we can go to the site on our computer will tell us what is the most recent data concerning activity of a particular antimicrobial agent against the pathogen that's being isolated. So it's really important for institutions to have this available to their clinicians. Well, targeted therapy refers to the fact once we do have the result of the culture and the susceptibility, because then that information actually tells us for this particular isolate what is the best antimicrobial agent. So once we have that information, it is very important for us to do targeted therapy. We may switch from one drug to another because it's better. It refers to this concept of de-escalation, which is very important because we may start a patient on very broad spectrum antimicrobial therapy with the thought that it's going to give the greatest likelihood of covering whatever the pathogen is that eventually is isolated. Once we get that result of the culture and we see it's a microorganism that's not multi-drug resistant, it's really important for us to downscale or narrow the therapy, like you said, for more specified pathogen-directed therapy. We call that de-escalation, and that is a benefit for many reasons. In some studies, it actually shows that it reduces mortality, but certainly it reduces costs and adverse events. We know, for example, that the more broad-spectrum agents we use, if we don't have to use them, can lead to more adverse events. One example would be increased incidence of Clostridia difficile, which is a very significant hospital-acquired infection. It can cause a lot of morbidity and mortality. And also, it reduces costs in the long run if we can use a less broad-spectrum antimicrobial agent. And very importantly, reduce further selection for resistance.